everyone, and welcome to my channel. Today we will be discussing about practicing dentistry in a country which is famous for its breathtaking natural landscapes and rich history and culture, which is Ireland. We have Dr. Saba with us, who has practiced dentistry in Ireland for 2 years, and she's here to share some useful information for everyone. Welcome, Saba.
Hi. Thank
Hi.
you for having me.
So tell us more about yourself.
So I'm a dentist. I studied dentistry in Pakistan. I graduated from Army Medical College and I got my bachelor's in dentistry from NUST in year 2011. And I've been into practice, in and out of practice because of my circumstances, because I was moving countries. But I moved to Ireland with my family in year 2016. That's when I started exploring options in Ireland for dentists who have, studied overboard. So I remember I was collecting information about the Irish dental exam, and there's not much information on the web. There's
That's
not many
true.
people. There's not many people who want to share, and honestly, I think they don't even have the structure of the exam as well, is not as well
That's true.
out there like other countries. So it was quite a struggle, but eventually I made a brave decision to give the exam in year 2017. I registered for the exam. That's when I applied for it the first time.
Thank you so much. So Sabah, our fellow dentists and students have a few questions for you. Shall I start?
Yes.
Okay.
Go ahead.
So the first question is about the application process. Is it easy to get placed for the exam, or is it tough? How does it work?
So honestly, I think I was very lucky that I was in Ireland in the time when it wasn't as popular. Now it's a very popular destination because I think everywhere else, like in the UK or in even America, things are just getting tougher with every passing year.
True.
When I was there, it wasn't as difficult, but I would say like the application process nowadays, what I've heard from my fellow colleagues, it's getting like it's very, very cutthroat. So according to my knowledge, like when I applied for the exam, I applied online and through post. I did my I sent them my documents to the council. But now I've heard like you get quite an edge if you are already living in Ireland while handing documents and everything.
So you have to hand away documents now.
Yes, I mean it's not compulsory, but they basically do is they have really limited seats, and they offer you seats according to like first come first serve basis.
Okay.
And I've heard people actually line up outside the dental college, like the dental council, maybe before. So obviously the first 10 candidates get it, and I'm sure like your post is not going to reach there before that.
So that's tough. So about the exam pattern, how many papers are there, and are there MCQs based or practical? And how did you prepare for the exam? That's very important. Do they have some information on the website? Did you have the past papers?
So again, I think the time when I gave the exam, things weren't as complicated. So when I gave the exam, I don't know if it's relevant going into information about that because things are changing every year now. But when I gave the exam, we had two parts. And both the parts had part one and part two both had a big chunk of subjective answering, like answers. So you were asked just MCQs like the rest of the world has. You were actually asked to write down a big paragraph of things explaining into the sciences and stuff. But now I think and they've converted the paper into short questions. So
but
you
still
just
no
have
MCQs.
No, I think they do have they have a mixture of things. So they do have MCQs as well, and then they have so you have you have 5 questions in where they ask you like it's a series of, so you have like 5 questions and then they have series of sub questions like A, B, C. So if anybody is familiar with the format in ORE, you have like in part 2 you have these kind of questions as well. I think it's called SEQs. And so like the first question is related to the second one, and the second is related to the third, and the third related to the fourth. So if you get one there's a good possibility you will get all of them wrong. Do you get it? Like, so the SEQs are basically that pattern of question. But they have a mixture of things now. Like back when I was doing the exam, they didn't have MCQs or anything. They just had subjective questions. But now
Okay.
they have a, they like the
Both
things
the
are
time.
changing. Yes, and they also have a bit of, I think, uh, like a bit of practical things as well, in even in the subjective papers and stuff.
So the questions they are practical from the practical subjects, clinical subjects, and the basic sciences as well.
Yes. So again, like the when I gave the exam, things were quite different. I think they changed quite a lot of things in 2019 or 2020. Actually, they
Mm-hmm.
changed quite a lot of things because they've made a lot of things very clinical. So
Okay.
when I gave, it wasn't this clinical, but
Mm.
when now they've changed things into very clinical questions. So only if you are into practice, you would be able to answer them.
Just like LDS, because LDS has got more clinical questions than ORE. ORE
Yes.
part one is has more basic sciences questions, right?
Yes, but I have a bit of knowledge about ORE as well. Personally, I think like ORE and LDS have always been very clinical,
Mm-hmm.
but to the Irish exam, but now they're changing their format into towards clinical as well. So I don't know what
Yes.
the content is going to be like. Personally, I think like for the past 3-4 years, they've progressively changed their pattern from being
Mm.
subject, going into. So I'm not really sure. They might just completely be very
Clinical.
clinical.
Mm. So the pattern is shifting from basic sciences to clinical subjects. Okay. So about the preparation, how did you prepare for the exam? Were there any past papers? Was it
Yes,
easy to
so
get the past papers?
I actually had a friend who had a big chunk of past papers, and I remember she gave them to me.
Mm-hmm.
Um, like I'm saying, there are very little people who actually share a lot of information. So she gave me past papers, and even the past papers, like we had no answer key or anything. We just had questions,
Mm-hmm.
and with a couple of my colleagues and stuff, people who were studying for the exam, we collectively made like a booklet kind of thing with
Mm-hmm.
answers. Uh, Whoever is like, I might actually, I've given all the notes and booklets and everything to people who I knew back then when I
Mm-hmm.
passed the exam. So I don't know if people are still willing to share or whatever, but I'd like we there are past papers, and if personally from my experience, if you cover the past papers, you can answer 60% of the paper, and then the rest 20-30 is just your luck. you know
Mm. So are there any Facebook pages which might
there
help
are,
the
they're
candidates?
not,
Sorry, I think.
unfortunately, the pages are not very active. Like there's
Okay.
nobody on them. Even if you go onto pages, you will just see questions and you wouldn't really see answers, like people
Mm-hmm.
answering things, if you guys have. But yeah, definitely there are pages, but they're not as active for
Okay.
sure.
Okay. So can the dentist in Ireland work as hygienist or nurses? Do they require license to practice as a dental hygienist or therapist?
So, um like rule wise, you're not supposed to practice as anything else. Even if you're a dentist, if you're a specialist, you cannot practice as a general dentist. Even if you're a
Okay.
specialist. Yeah,
Hmm.
if you're a specialist and you're registered as a specialist in the dental council, the Irish Dental Council, you're not supposed to be practicing general dentistry. That's if you go by the book, like by rules. But then, our like what I thought was Ireland is a very accommodative country. Like I would personally say they do have, like they do cut corners and stuff. So if you are lucky enough and if you get into a good team, you can actually get a position. But I don't know if they will do, like, legally they will not put you on board as a dental hygienist, but maybe they will allow you to cover scope of a dental hygienist even if you're not registered. Because I personally knew a couple of girls who were giving the exams,
Mm-hmm.
and obviously, like, you have to wait a bit for to appear for the exam. So they
Yeah.
were practicing dental nurses, and then when they saw that, okay, they've passed one, now their respective clinics offered them a bit of dental hygiene work as well, just part time, just so they get a bit of. the field of dentistry and stuff. But legally, no, you're not allowed to. Like, you cannot go and start applying for dental hygienist and dental nurses jobs and stuff. I don't think you will get an answer.
So
But like I'm saying,
can the clinics get into trouble, or the candidates get into trouble for applying or for working as a dental nurse?
um, I don't think so, because like I'm saying, there are not many people who are going to complain against you. But
Mm-hmm.
these are uh, so like I'm saying, it's not legally allowed to do it. It's just like
Okay.
driving a car. Legally allowed to drive a car, but people drive the car without their license anyway. So if you know, because obviously if you mess up,
Hmm.
even as a hygienist, there are a lot of things that you can do, because you eventually are touching the patient. So if you
Yes.
mess up, that's the end. Then you're
Hmm.
going to have a mark on yourself. So I don't know if anybody is willing to take that risk, but yeah, but there are some very nice clinics, and they, like, people who do want to accommodate foreign dentists would
Hmm.
actually give you an opportunity like this. But I know a lot of girls who were practicing as dental nurses before
Okay.
they actually passed the exam.
So, but I want to clear it to everyone that this is not the case in UK. The route for dental hygienists and therapists for expat dentists has been closed, and you can practice as a dental nurse, but mostly here the clinics are asking for valid GDC registration. So I think it's tougher in UK. So,
Definitely. It's a much bigger market. UK is
yeah.
much plus it's very saturated. Like I'm saying,
Hmm.
in Ireland as well, you do have a lot of people who want to appear for the Irish exam, but then they have only 10 seats, whereas in UK they have 300 seats
And now there are
twice.
600 seats in ORE Part 1.
So
Yes.
there is no comparison. 610. So like
Yeah,
the market is
definitely.
in in the UK. I
Yes.
think that's one of the things that you don't get jobs as dental nurses, or any
Hmm.
other dental
It's
professionals.
hard. It's hard here. So, Sabah, what about the scope for other specialties like prosto and ortho? How do they get to work there? Do they require license, a GP license, or a specialist license? Is it the same?
Depends on the route that you take. I know a couple of people who've actually applied for like they're specialists in their own country. So let's say prosthodontics.
Mm-hmm.
Uh, One of my colleagues was a specialist, like he had done his FCPS Part 2 in prosthodontics, and he
Okay.
wanted to prosthodontics in Ireland. So
Mm-hmm.
what he did was he applied for FFD exam, and he
Mm-hmm.
cleared his Part 1 and Part 2, which makes him a registered specialist in Ireland. But
Oh,
he was asked to give the Irish dental exam, because obviously without that he's not allowed to practice. Obviously, because you're not registered yet. But once
okay.
he passed the exam, he's only allowed to do prosthodontics. He's not going to do general dentistry. And mind you, the biggest cost that comes when you start practicing is your insurance.
Yes, I was going to say that. Yeah.
Specialist, your insurance just goes skyrocket. Like it's just really high compared to the general dentist. And if you ask me, general dentists can practice nearly anything. Like for myself as well, because most of the dentistry is prosthodontics anyway.
Yes.
um the scale and polish and stuff, obviously it's all like full mouth rehab, especially with the recent you
Mm-hmm.
know uh, trend on social media. Everybody's showing off their full veneers and stuff. So it is eventually coming down to dentistry, is coming down to prosthodontics. So
Mm-hmm.
if I you whoever is a specialist in prosto or whatever, I would just register as a general dentist and practice whatever I like.
Okay. Okay. So, but for the specialist, they have to take the exam, the specialist exam, and then they have to take the GP exam.
Yes.
And then they can only practice as a specialist. They cannot practice as a general dentist.
No, whereas if you register as a general dentist, you can actually just practice everything.
Even the
Because
ortho.
yes, even ortho, but with
Okay,
ortho,
that's interesting.
yes, even ortho, because it depends. Like I personally, I don't practice ortho,
Mm-hmm.
but I have a lot of colleagues who are just general dentists,
Mm-hmm.
and they were practice they had a lot of their ortho patients and everybody. But it just depends. Like some people, some it depends on the patient actually. Some
Mm-hmm.
patients do work and they do not come to people who are not specialists.
Okay. Yes.
Yes. So if that's the case, obviously you are going to miss out that chunk. But I personally think like that's not the majority of people. Everybody just wants affordable dentistry. So if they
True,
think that
yeah.
you are, they would come to you. So if you have one patient who is paying you blah blah amount of money, it's better. It's like I think it's worse than like it's better you have 10 patients who give you a little bit, but at least they're coming. Do you get it? Because you get your experience and everything as well. So definitely, like even if you're a GP, you can practice ortho.
Oh, that's good. Aligners as well, braces, aligners.
Braces, everything, everything,
Okay.
marine implants and everything. You, as a general dentist, you can do it.
Oh, that's cool because in Saudi you're not allowed to.
Yes, I think, like I'm saying, I mean, Ireland was, I think it's a very accommodative country.
Yeah, and so is UK. In UK also you can practice as a specialist if you're registered as a general dentist.
General dentist, yes, because it
Yeah, you
just,
can do implants and aligners and everything.
eventually when you get your insurance, they ask you your scope of work and they
Ah,
don't ask
okay.
you specialist or you're not. But if you are registered as a specialist, your insurance is very high.
Yeah, I'm sure. So Saba, what about the job opportunities there? Was it easy to get a job, or did they require any prior experience, prior Irish experience?
Again, for job, I personally think it really depends on your luck. I was very, very fortunate. So I initially, because I had a bit of a break from dentistry, I really wanted to get into a hospital setup. So I
Mm-hmm.
managed to secure a job. I got registered in November to
Mm-hmm.
2019. I managed to get a job within 2 weeks in
Oh,
the HSC.
mashallah, that's nice.
Yeah. I thought so as well. I thought, wow, you know what, the HSC, okay, I'm going to go into like the hospital setups and whatever, and I will have a bit of help and stuff. But personally, I think it didn't work out for me, and that's when COVID and everything happened. And
Mm.
they were very, very nice clinic, they were actually looking for a dental hygienist.
Okay.
So I joined them as a dental hygienist, but then very soon, like after 2, 3 months, I upgraded to a general dentist, and
Mm-hmm.
they were very accommodative with everything. Like they would just let me take my own pace. They wouldn't burden me with a lot of work.
Mm.
So, and like I'm saying, they were like, do whatever you want to do, even aligners, ortho, whatever. It depends on the dentist. So that's why I'm saying sometimes you are very lucky to find uh, find a clinic where they're not too fussy on what you're doing.
Okay. And that,
But some and honestly, it plays a bit like they leave it onto you as well because you practice. You're not an employee in
mhm.
Ireland. You have once
I
you
think
have
you are sort
just
of self-employed, right?
exactly. So yes, you are
Yeah.
self-employed. Whatever happens with you and your patients stays with you and your patient. It has nothing to do with the clinic. So
Okay.
that's
And
why
that, hmm.
just like do whatever you think is right
Okay. All right.
because
So what
you
about
invite
the
you.
private clinics? Were they accommodating as well?
Which clinic? Sorry.
The private clinics. You were the hospital setup, right? Earlier. And then when you moved to the private clinic, was it the same?
No, no, it was not the same. So that's why I was saying. So the
Okay.
private clinics are much better. So
Oh, okay.
when I was working for the HSE,
Mm-hmm.
I was not. I was an employee. I was employed by them,
Mm-hmm.
and the thing about it was I didn't have to get my insurance because it was all government
Mm-hmm.
funded. I
Mm-hmm.
didn't have to get insurance. You know, like a big chunk of my money, my salary used to go in the insurance. I didn't have to get it because it's obviously the government pays for the HSE and everything. That was a good thing. But with the HSE, they actually like they had an eye on everything I was doing. And you know,
Okay.
it just but when you have a bit of experience and when you're not a newbie in your
Mm.
career, you really want people to pinpoint everything. So they were
Yeah.
actually even at my trays after like I'm done with the patient, you know, and how I take the x-rays and stuff. And I was like x-ray machines and everything is really different here, you know, like
Yeah.
just give me.
Absolutely. Yeah.
So I just thought they were very into my things. And they would
Mm.
actually, you know, like so like my um boss who hired me, she used to actually take full on backup from my nurse. What did Saba do
Oh.
today? What did she do? So I thought that was a bit of, you know, going like overboard with things and stuff.
Mm.
My experience with the HC was very interesting, but honestly, I left the job very soon. I
Mm.
was like, I don't do this anymore,
And then you
and
moved to the
especially
private clinic.
Yes, and then I moved to the private clinic. And once I found these guys, I didn't go anywhere. Like I was working in another clinic for very little time. I think for only 4 months, and
Mm-hmm.
that too part. This was the clinic that I worked for
Mm.
2 years.
Oh, that's nice. So, Sabah, is the procedure same for the Pakistani dentist? Like, how does it work for the dentist for applying for Pakistan? Like, do they come to Ireland, take the exam, go back, and then find the job opportunities? Is it easier for them to take the exam and then find the jobs if they get
Uh,
registered with the recruiters? And how does it work for the Pakistani dentists?
Honestly, Mariam, I don't know if I can give a lot of input into this personally, because I didn't have to go through that route. I
Hmm,
could just
I'm sure.
already living. But personally, there are a lot of people that I know, my class fellows, my colleagues, who wanted to
Hmm.
apply for the, and they've applied as well, but their application was rejected 2, 3 times. Sometimes there was a document missing. Sometimes they just said our seats are full, you know. So
Hmm.
I'm not sure how convenient it is for Pakistani dentists to apply from Pakistan. But if
Hmm.
somebody has, somebody can maybe apply for a visit visa and then
Hmm.
be in those dates, and
Be
then
in
hand
Ireland.
over in Ireland and hand over their application in person on the date that the applications open up, maybe they have a better chance than
Hmm.
applying, through post and things like that.
Hmm. So,
But like I'm saying, I mean, things are changing. I don't know if they will change it anytime soon, but this is how it was still last year.
okay. What about the job opportunities? Like, do they connect with the recruiters? Is it easier for them to find the jobs being in Pakistan?
Again, with jobs as well, like personally, if you ask me, and according to my experience from the market, they do value dentists coming from Pakistan and India because they do consider that we do have skills. But again, I would say that some uh, practices want to be very, very safe with their choice of
Hmm.
how you are. Some like Dublin is very different, but some parts of Ireland can be very like they can be very. I wouldn't want to use the term racist, but they can be
Hmm.
very judgmental who is treating them.
Okay. Okay.
They would somebody who looks a bit European
Okay.
than
Good.
Pakistan or Indian and
Yes.
stuff. But they do agree with the fact that we have skills and we would make a very nice team or whatever. But obviously, how you present yourself and how you
Hmm.
stuff matters a lot
Hmm.
in the countryside areas of Ireland. Definitely, if you're looking to practice there, these
Okay.
things will be.
So are there chances for Pakistani dentists
Definitely,
to?
there are chances for Pakistani dentists, and especially like I'm saying for there are a lot of Pakistanis that I know who have their own clinics.
Oh, wow.
So
Like,
they if
like they came from
Pakistanis,
Pakistan and set up their own clinic in Ireland.
yes, and they're like I'm talking about people who are much older than us, like in their 40s, 50s, who've
Okay.
come years ago, exactly, and now they have their own clinics. So sometimes, like if you are lucky, you find a nice person like that, maybe they want to give you a chance and let you join the team or whatever. So I mean, I personally think like the job opportunities, it just depends on your luck, who you interact with, who you know have
Find the
met up
right
with.
network, connect
Yeah,
with the right
because
people. Okay.
it's easy to find an opportunity, but if you ask other dentists, they're like, oh my god, it's taking forever for me to find a good job. So it
Hmm.
just depends who you
Everyone
interact
has
with.
different experience.
Exactly, yes, it just
Okay.
depends on.
So I don't know if it's a thing or not, but people are asking about the passing ratio. What is passing ratio for the Irish dental exam?
So the passing ratio when I did my exam was very, very low. Um I think only 8 to 10% of the people candidates passed.
The
But
first part or the second? Both.
the first and the second, I would
Okay,
say.
both. Okay.
That there's a higher chance of passing the first, but like I'm saying, I'm not really sure uh how they set up the passing ratio,
Hmm.
like because I was told that so when I passed the exam there was a total of I think 42 or 46 candidates who appeared for the exam and only 7 or 8. So
Okay.
I'm not really sure how they come up with this, but the last to last year a lot of my friends appeared for the exam, and there were 21 candidates who passed out of 45 or 48. So that's nearly like 50%. So
Hmm.
that's why I'm not really sure how they choose how many to pass or not, but it just varies. I think the COVID had a bit of load on them to actually, get through a lot of candidates. So
Yeah.
maybe I'm not really sure, but the criteria just keeps changing.
Okay. So, I think that covers almost everything. Do you want to say anything else about dentistry in Ireland? Do you come across any more questions you think can be useful for people?
Just I would just want to say, do not look at other people and do not think that they're living a dream life. Even when you pass your exam, it's a long road
Absolutely,
to see
yes. I'm sure.
to
It's a lot of
successful.
struggle.
Honestly, when I was giving my exams, I was like, my I aced it. Like I cracked the code. I'm over now. I have my registration. That's it. Like I'm on the sky. But
Yeah.
honestly, when I started working, I was like, shit, I'm back on the ground. So
Yeah, I know.
long journey, and
Yes.
every day you want to do your best. The only thing that comes with practicing in a country like Ireland, UK, America, Canada, the only thing that adds on to your thing is um, the insurance and
Hmm.
the ability of people to backfire. So if you are not doing a good enough job, it will backfire, because
Hmm.
like if you have a bad experience, even in my 2 years, I've seen it all. Like I've seen people go complain about me as well, even though I stay on a very safe margin. I do not cross
I
my lines.
know.
But yeah, but there are people, and but then again, like I'm saying, if you find people who, if you are surrounded by good dentists, they would actually not pinpoint things at you. They would actually try and lift you. That it happens with everybody. It's okay.
Exactly.
So remember that it's a constant struggle, not just
Hmm.
till the exam. Done with that as well. It's a constant struggle because life is another name of struggle.
Yeah.
So
And I think it's
it's
remarkable how you started with, even after the license, you started with the dental hygienist post.
yes.
You didn't start working as a general dentist right after getting the license.
I'm joking, Mariam. You will not believe. I thought when I start as a general, as a hygienist, I would be
Hygienist, yeah.
flying to the office, and I would be like, oh my god, this is the easiest thing. I'm not joking. First of all, I was 30 minutes overtime, so all the nurses in the practice were waiting for me because I think I had around 12 patients the first day, and my clinic closes at 8, and I was still doing my last patient at 8:35. I was that
I,
slow.
I know. I work with the hygienist here, and it's different. It's not just scaling and polishing. It's completely different. Like,
And plus, like if you are coming from Pakistan, in people in Pakistan look at you as a doctor or wow, whatever. People
hmm,
in Ireland, picky. Like some of them would just come again and again, and they're like, "Oh no, I don't feel this, I don't feel that." Sometimes they just start chit chatting and they just don't keep quiet. So you're just like, it's literally not like treating a patient. It's like a client. You have a client in the seat. Want to make them happy, so they come back to you.
yes,
Otherwise, they literally go out and they complain that she was so rude. She didn't speak to me. She didn't ask me how my day was or whatever. Like, do you get
hmm,
it? So
hmm.
so that's why I'm saying, like, more than your work, it's how you deal with your patients.
Yeah, I think it's a
And
cultural difference here. I understand. Yes.
you feel it. Like no matter what kind of practice you go into, you feel the cultural difference
Yeah,
because
there is.
they
Yeah.
can things from you.
Hmm. There
Not the
is.
same in. So
I
yeah, I would just want to say that exam is just the first step, but personally, I think, and even to some of my fellow colleagues who couldn't actually make it through the exam, I would just tell them you're no less of a dentist. This is just a system they've made for us to come and pass the exam. If somebody passes, this is no. I mean, according to me, I don't think it's criteria of how good and like how much more abilities a person has. It just depends on your luck. For myself as well, I personally think I was very lucky that I entered on the right time in the Irish market and I made it to a
I
nice
know.
clinic, exam and everything. So just take it
Because
easy and enjoy it
yeah,
wherever
because
you
I think
are.
the process is becoming tougher for us now, be it
Getting to
UK, England, UK, America, Ireland. I think the
Yes,
process is becoming
unfortunately,
tougher.
your application is not accepted, you just take it to heart. Like, oh my
Hmm.
God, shit. If you fail the first part, or if you fail any exam, you're just like, oh my God, I'm not worth it. I'm not good enough. I personally think that's not the criteria. They have
Hmm.
something else. They're building their own, like, oh, they're building their economical status. It has
Yeah.
nothing to do with you are with your dentistry. Because so when I was working in the clinics, I've noticed people are doing such a bad job, and they've been
Hmm.
working for past 7 8 years in Ireland, and nobody sued them.
Hmm.
And I'm something which, like, I'm doing something so small, let's say as scaling, and I'm scared, oh my God, she's gonna sue me. Do you
Yeah.
get it? So there is no, I think it's like, this is not the scale. If you pass the exam, if you get into dentistry, this is not any scale to measure yourself. I think you are a dentist if you've graduated, and just enjoy your career, your profession, wherever you are.
Hmm. So, in addition to general dentistry practice, Saba also offers services in Botox and fillers, and she's doing her level 7 diploma from acquisition aesthetics. Saba, could you please tell us a bit more about the practicing aesthetics in Europe? We are just running out of time, so if you could listen a bit about aesthetics as well.
So, why I got into aesthetics was because I was practicing general dentistry for some time, and I was like, I need to get into a specialist, treatment as well. I want to provide something extra to my clients more than
Hmm.
dentistry.
More than general dentistry services, yeah.
Dentistry, and I don't know, just looked like a very hot cake. Like, everybody wanted to come, like, everybody who was coming into the clinics was like, do you think my lips look like this? Do you think my teeth look like this?
You
Blah blah blah.
know,
And I had a colleague who was actually practicing aesthetics with dentistry as well. And he was telling me that it actually makes a big difference, because once you do, like, for example, you do full, like, front veneers,
hmm,
and the patient is happy with it, you do a bit of Botox, like a bit of fillers in the upper lip, and then all of a sudden she starts liking her veneers as well. So she was like, it's everything is connected.
yes,
And
it is.
I didn't really agree with him when he was trying to explain things to me. But when I went into the foundation course, I was just blown away with the amount of difference a single injection could make in people's
Yes, I
appearance.
know. And we can treat the dummy smiles by Botox as well.
Exactly. And I was just blown away by the like, how quickly can you make a difference, and how quickly can you actually make the other person confident. Because sometimes you personally think you've done a good enough job on their teeth, but
Hmm.
still they're not. It's not the teeth that bother them on the first place. Like, they were maybe bothered by their droopy lips, or something else. So the minute you join dentistry with the facial aesthetics, I just thought it just
Yeah.
blended in so
Hmm.
it was just. And honestly, when I was looking into jobs, so I moved from Ireland to Dubai, and when I was looking into jobs for dentists, this is actually a requirement now, a dentist who's performing aesthetic treatments as well.
Wow.
Yes.
That's cool.
I personally thought, then, rather than just leaving it,
Hmm.
I just, and after the foundation course, I fell in love with it. Like, I'm telling you, I just thought it was so amazing that how could you make such a huge difference with such little things.
Yeah. And how
So,
was your experience with acquisition aesthetics?
very nice. I think they have very, very well trained and well structured program.
Hmm.
So I went in foundation course, and the day I finished the foundation course, I booked that very day I booked the advanced course with them
Advanced.
as well.
Hmm.
Yes, and when I did the advanced course, I had a very nice tutor. I think her name was Nancy or something. I've forgotten, but she was a very nice tutor, and she was like, "You have to attend my lip master class." So I booked for the lip master class, and every time I go onto their courses, I'm just like, "Oh my God, wow! Like, how can you do so much
I
with
know,
your?"
right? With the new
It's
techniques and new things. Yeah,
it's
it's amazing.
Yes, it's just amazing. So I just personally, like, this was the one aspect of dentistry that I never thought I would explore, but when I started exploring it, I think I have a good interest in it.
And I think this is our area of specialty, head and neck. So,
Yes, exactly, exactly.
so Sabah, thank you so much for sharing this useful information. And I hope you all enjoyed it. And thank you so much once again for coming to my channel and giving us the interview.
More than welcome, Mariam.
And I'm sure there will be questions on my Facebook page. So
Yes. So if anybody has any more questions, just make sure you put them down on Mariam's page, and then I will try and answer them whenever I get time on my hands, for sure.
thank you. Thank you so much, Saba. Okay, well, that's it from me today. Until next time, bye bye. Bye, Saba.